Hey guys, Abby Johnson here. So big news today out of Texas and Louisiana. All of you know I live in Texas. So really big news today. So the Fifth Circuit Court of Appeals made the decision to uphold the request of Texas and Louisiana to remove Planned Parenthood from the Medicaid program. So basically, there's reasons for this, for them making this decision. So, basically when you, as a provider, sign up to be a Medicaid provider, you have to uphold certain rules. You have to follow certain rules, certain regulations. And, part of that is, abiding by the law. So there have been multiple cases where it has been, proven that Planned Parenthood, particularly in the state of Texas, has been a part of Medicaid fraud. In fact, in 2013, the Planned Parenthood was required to pay the state of Texas over $4 million because they were caught in a Medicaid fraud scheme. There have been other external audits, 51 actually external audits that have been done with Planned Parenthood. Every single external audit that has been done with Planned Parenthood these external audits have found that in every single time Planned Parenthood, there's been some sort of problem with Medicaid billing. So most of the time it's been overbilling. There's been Medicaid overbilling. Now this is a problem because when you file, when you apply for Medicaid, when you enter into this Medicaid contract with the federal government, Medicaid is a federal program, then you basically say, I'm going to abide by the rules of this Medicaid program. So, but 51 times in these external audits, these auditors have found that Planned Parenthood has not They have not followed the rules of the program that they signed up to uphold. So, when you couple that with the Medicaid fraud that's been proven over and over again, that's a problem. And so that is basis enough for the state of Texas to say, and the state of Louisiana to say, we no longer want Planned Parenthood to be a part of the Medicaid program here in our state. And so they have complete just cause, just like if it was any other program, not just Planned Parenthood, just if it was any other provider. If a provider is being a bad steward of those funds, then the state has every right to say they are being a bad steward of these funds. They are committing Medicaid fraud. They are overbilling Medicaid. They are not being a good steward of these funds, whether it's Planned Parenthood, whether it's ABC, community center, whoever it is. The state has the right to say, we no longer want them to be a partner in the Medicaid program. And so that is essentially what the state of Texas and the state of Louisiana did. They filed suit. The Fifth Circuit Court of Appeals said, yes, there has been so many cases of fraud. There have been so many cases of misuse of these Medicaid funds. They have just cause to boot them from the Medicaid program. So that's exactly what happened. Now, of course, Planned Parenthood's response has been, oh my gosh, but these poor women, where else are they going to go for health care? Now, we knew that was going to be their response. So, but here is the reality. Planned Parenthood provides such limited healthcare services for women who are on Medicaid. Now, please understand, people who are on traditional Medicaid are the poorest of the poor. Okay, these are people who are truly indigent. So these are people who lack transportation resources. These are people who lack childcare resources. These are people who maybe live in group homes. Not anyone can get on traditional Medicaid. It's very difficult difficult to get on traditional Medicaid. So this is a traditional Title 19 program. Planned Parenthood actually does not see, truthfully, that many people on traditional Title 19. There's not that many people on traditional Title 19, in all fairness, who are not children. So there's not that many adults on Title 19 programs and on traditional Title 19, and Planned Parenthood does not do pediatric care. So adult women who are on traditional Title 19, there's not that many of them, and for those who are, Planned Parenthood just does not provide that many services for them. The services they provide are extremely limited. So they would provide, maybe a pap smear and some STD testing and then contraceptive services. Now, if for some reason during that pap smear, that well woman exam, any abnormal results were found. So I'm talking about, an abnormal pelvic exam, an abnormal breast exam, her pap smear came back abnormal, if her blood pressure was elevated, if there was, some enlargement of lymph nodes, anything that was suspicious during that exam, they would have to, Planned Parenthood, because they do provide such limited care, they would have to refer her to what's called a federally qualified health center. Now, federally qualified health centers outnumber Planned Parenthood something like 12-1 in the United States. So these federally qualified health centers, they do accept traditional Medicaid. They actually accept far more title programs than Planned Parenthood. They have many more government-funded resources than Planned Parenthood does. And they provide actually comprehensive health care for men, women, and children. They actually do have pediatric care. They have vision centers. They have dental centers. They have on-site pharmacies. They are really a one-stop healthcare provider for low-income people. Now, so if anything abnormal shows up during an exam for a woman or a man who goes to Planned Parenthood, not very many men go to Planned Parenthood, but if anything abnormal shows up during that exam, Planned Parenthood is going to have to send this very poor, this indigent woman to a federally qualified health center. Now, as I said, this is a person who is very resource poor, very resource needy, transportation poor, childcare poor. So if that is true, if that is the case, why do we want to send her to a place like Planned Parenthood, who provides very limited care? Why wouldn't we want to send her to the one-stop shop in the first place? Why wouldn't we want to send her to the federally qualified health center on the first go, right? On the first go around? Why don't we go ahead and send her to the federally qualified health center where she can, if she's already transportation poor, let's not send her to a place where she's going to have to go somewhere else anyway, right? If she's having a hard time getting transportation, if she's having to take public transportation, if she's having to ride a bus, then let's go ahead and send her on a bus to the federally qualified health center so that she can take care of all of her needs in that one place. And by the way, many federally qualified health centers also have behavioral health services. So they have mental health counselors there. They have addiction help. So why not send her to that one place so that she can have her high blood pressure checked out? They have mammogram services. They have all kinds of services. They have lab services. She can get it all done in one place instead of having to take bus after bus, make appointment after appointment, because we know that for needy folks, most of the time they're not going to follow up on those those referrals. So if Planned Parenthood makes a referral to an outside source, like a federally qualified health center, in our clinic, over 75% of the time, they're actually not going to follow up on that referral. So why don't we just send them to the federally qualified health center in the first place, where they can go ahead and just get everything taken care of in that one stop? That makes the most sense. So we need to stop funding places where people are receiving shoddy healthcare, where they're not receiving that comprehensive healthcare package, so that people won't even be tempted to go to Planned Parenthood, where they receive subpar, second-rate healthcare. Let's fund the places, let's give more money to the places that are providing the comprehensive healthcare in the first place. Now, Planned Parenthood could rectify this, right? If they spent more time actually providing preventative healthcare services and comprehensive healthcare services for women, they could do this. But that would require them spending less time focusing on abortion. They're not willing to do that. In fact, just a couple of years ago, Planned Parenthood's former president, Cecile Richards, said that providing abortion services is as important to Planned Parenthood as providing Pap smears. So Pap smears detect cervical cancer in women. So it's as important to them that they take the life of an innocent child as it is to detect cervical cancer in a woman. So you see, that's where their actual priorities lie. It's in abortion. And we see that over and over again as Planned Parenthood continues to open up clinic after clinic that provides no preventative health care for women. We see clinics like in Overland Park, Kansas. We see clinics in Utah. We see clinics in Massachusetts. We see clinics that are popping up all over the country that are abortion providers only for Planned Parenthood. They provide abortion services 6 days a week, over 40 hours a week. They don't do any birth control. They don't do any Pap smears. They don't do any breast care. They don't do any contraception. They do abortion only more than 40 hours a week. So we see where their priorities lie. We see that their priorities lie in abortion only when we look at their annual reports over the past 10 years. Contraceptive services down, Pap smears down, well woman care down, contraceptive visits down. The only thing that is consistently increased in Planned Parenthood services is abortion. So, we need to take this, all of this data that I'm talking about, and put it out publicly. If Planned Parenthood was really about women's health care, they would be focusing less on abortion services. They would be focused more on how to prevent abortion in the first place. They would be focused more on preventative women's health care. They are not doing that. They are focused only on defrauding the government. They are focused on providing abortions, getting into our public school system to sell abortions to our young people at a very young age, to normalize abortion to our young people at a very young age, to make them consumers of abortion at a very young age. They are about pushing abortion at every corner, around every turn. That is their focus. So that's really what this court challenge was about. We're very happy that the Fifth Circuit Court of Appeals upheld this court challenge. It might go to the Supreme Court. The Supreme Court might pick it up, or they might just rule in favor of the lower court's decision, which is what we sort of expect them to do, because every state has the right to say, this provider is misusing Medicaid funds. That has been proven time and time again through external audits and through Medicaid fraud, that they have willingly said, yes, we committed Medicaid fraud. In fact, they said it so bravely that they had to pay $4.3 million back to the state of Texas. So they said it so openly and so willingly that they had to pay over $4 million to the state of Texas because they committed fraud. So through external audits, through paying back state money back to the state of Texas. We know that they are misusing Medicaid money. We know that they are committing fraud. So because of that, because of this public and willful admission to misusing Medicaid money, that is why they have been removed from the Medicaid program in the state of Texas. So I hope that this helps everyone understand the decision from the Fifth Circuit, and we are hopeful, we are prayerful that that decision will stick and that the Supreme Court will rule in favor of the lower court's decision if it does go up to the Supreme Court. Hopefully this will also set a precedent for other states to make the same decision. So, all right, God bless, and hope you all have a wonderful day.